All right, good morning, everybody. It's 8:30. We'll call this morning's meeting to order for Tuesday, April 6th, 2021. And first item will be the approval of the agenda.
So move, Mr. Chair.
Okay, we have a motion by Commissioner Mojo, second by Commissioner Gross. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. Citizens to be heard. Do we have any citizens in the audience to be heard? You're all here just to observe. Okay. Anybody online?
We do not, Mr. Chair.
All right, very good. The next item, we have a couple of employee recognitions, so we'll do those. Our first one is Laura Jones. I didn't see Laura come up, right? Okay, well, Laura is the office coordinator for the county attorney's office, and we are presenting to her for grateful recognition for 20 years of outstanding and dedicated service. So, yeah, Brian, do you want to take this for her, and do you want to make a few comments?
I got all kinds of nice stuff to say about her.
Okay, well,
I don't know, now,
you can tell her thank you on our behalf.
yeah, well, I'll tell her thank you. Laura obviously has been with our office for 20 years. I've known her for many years. I know Commissioner Ebinger knows her very well. She was my own personal legal secretary for many years and just a great asset for the county and for the taxpayers of the county itself. So I'll make sure she gets this. Thank you.
Yes. Next, we have somebody who's been with us for 30 years, and she promised 5 more. No? No. So this is presented in grateful recognition for 30 years of outstanding and dedicated service to Clay County its citizens, and Julie Savat. She's our county administrator for a corrections facility. And I want to just say a couple things before I turn it over to the sheriff, that when we were going through our new construction of our new facility, and the years prior to that planning for it, Julie was just key to that. And I want to thank you for everything that you did to make that building what it is today, and for the people who house there, how good a facility it is. So thank you. But you better come up and get your plaque. And then the sheriff is going to say a few words.
Thank you, Mr. Chair and Commissioners. I don't quite know how to sum up Julie's career here at the Sheriff's Office. She has been a fantastic employee for the Sheriff's Office and for Clay County. She continues to strive for excellence and to ensure that everybody in that correctional center is taken care of, from the inmates we house to the staff that we have there. Very instrumental in working through several challenges with the old building and overcrowding and housing, and working with a budget to try and figure out where to put all these people and how we're going to pay for it, to building this new facility and to having a behavioral health unit that is a model for other correctional facilities across the state of Minnesota. We have a fantastic facility over there, and about 95% of it is because of our jail administrator. So we have to be very grateful for Julie for the work that she's done. We're also going to be missing Julie come July 1st. She is going to retire, which is a big loss to Clay County, and it's a big loss to me because this has been a very smooth transition for me because of Julie. Julie, I appreciate the work that you've done. I appreciate the friendship that we have. You are truly going to be missed, but you are welcome here anytime. And we may have to call you every now and again for some advice because when it comes right down to it, if there is anything you need to know about DOC rules or 2911 rules and laws, she's the expert at them. So we are truly going to miss you, but thank you for your 30 years of dedicated service to Clay County. Thank you.
think that should be enough business for today.
Are we done?
Well, you can't top 30 years, so. Okay, our next item is the approval of the bills and vouchers.
Move to approve.
Second.
Okay, we have a motion by Commissioner Gross, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. We have 3 sets of minutes to approve today. We have, and we'll do them all together. We have them from March 9th, 16th, and 23rd. Unless there's any corrections, I would entertain a motion to approve.
So moved.
Okay.
Second.
Okay, motion by Commissioner Ebinger, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. All right, we'll move into our 8:35 item, and Justin, you're here today for Dave? Okay, good morning.
Good morning.
You've got,
And I did bring Matt with just for the first item.
oh, sure, yeah,
There was a-
you've got 4 items here that.
Yep. I'm here for moral support.
All right, well, that's good to have.
So the,
Can you admit that person in the meeting? Thanks.
Okay,
Okay, so the first item is a MS4 MOU agreement between Clay County and the Buffalo Red River Watershed District. So as per Minnesota Rules 7090, both Clay County and the Buffalo Red River Watershed District are designated as an MS4, which an MS4 is a mandatory small municipal separate storm sewer system. And this requires both agencies to hold an MS4. So this year we are reapplying. The permit lasts for 5 years and you have to do routine annual inspections. And we did have an MOU previously with the watershed. And basically what the MOU does is it reduces regulatory oversight. So within the urban boundary, the watershed will recognize our county ordinance 2015-1, regardless of whether Clay County or the watershed owns that outfall. And I did pass out a map just showing the MS4 outfalls within Clay County. So our boundary is 1 mile outside the urbanized area.
all right, so you're looking for a motion to approve the MOU?
Yep, and the new MOU does, since we have to reapply every 5 years for this permit, there is language in the new MOU that basically says, it shall commence on the effective date and automatically renew upon completion of new MS4 general permits, unless either party shall request termination.
Yep. Yeah, Commissioner Murphy.
Sure. My question is, one, how is this different than how we've done business as usual? And 2, will there be any incurred costs that we have not planned for because of it?
This will not change anything that we've done in the past, and there should be no cost.
Thank you.
All right. Any other questions? Matt, do you have anything to add? You're here for support.
Just, yep, for support. Nope. I don't have anything to add.
Support then.
Yeah.
Tell us that we should pass this.
I think it would be a good idea just because it would reduce redundancies in administering this.
We do have an MOU with the city of Moorhead as well. There's a lot of new rules in the new MS4 permit, so we'll be bringing forward the one with Moorhead later this year.
I just told Commissioner Gross I was gonna make this meeting last till 12:30. On that, Matt, we can use your,
I'll make a motion to approve.
I could have brought the,
we have a motion to approve the MOU. Is
I'll
there?
second that
We have a
motion,
second
Mr.
by
Chair.
Commissioner Mojo. Any further discussion? That's one quick way to get motions. Okay, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. All right, your next item.
yeah, so my next item is approval of an engineering contract for pavement testing. So we requested a proposal from Braun Intertech for pavement testing on CASA 18, 31, and 52. So historically, Braun has done our pavement testing for 20 years, and 2 years ago, they did a large pavement management project. The work is needed to complete future pavement designs for next year for 18, 31, and 52. So they'll go out and do soil borings and do a bunch of different analysis to help us come up with a design section. The cost of the proposal is $23,963, and that'll come out of our budget.
Okay, and that's an anticipated cost, right?
Correct. We do pavement testing every year for the next summer's projects.
Okay, we have a request to approve the contract with a consulting contract.
Make a motion to approve the contract.
Second.
We have a motion by Commissioner Gross, second by Commissioner Cayley. Any further discussion?
Mr. Chair?
Yes, go
My
ahead.
question is the 23,963, is that budgeted?
Yes.
Thank you.
Okay, any further comments? All in favor signify by saying aye.
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 Opposed, the same. Motion carried. Your next item is the contract for soil borings.
Yes, so we got two proposals for soil borings and Comstock. Braun Enertech was a little bit cheaper than Terracon. The soil borings are needed for the reconstruction of CASA 2 within the city limits of Comstock. And this work will be reimbursed by the FM Diversion Authority. And the cost of that proposal is $5,345.
Mr. Chair, I'll make a motion to approve the item.
Motion by Commissioner Mojo,
Second.
second by Commissioner Ebinger. I'm going to give that one to him. I heard him first. All right.
Moving along.
Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. And finally, lastly, the dust control quote.
Yes, so on March 24th, we opened dust control quotes. We received two quotes, one from Knife River and one from Glacier Enterprises. Knife River was a $1.83 per gallon and 54.9 cents per square yard. Glacier Enterprises was $1.28 a gallon and 0.384 cents cost per square yard. The price is the exact same as last year, and I would recommend approval of the low quote from Glacier. They did a really nice job last year.
I'll make a motion to approve Glacier Enterprise.
All right.
Second.
We have a motion by Commissioner Gross, second by Commissioner Ebinger.
You guys got to jump in there.
And we have a comment.
Thank you, Mr. Chair. My question is, I know in the past we have had a concern with residents where the dust control has gotten bladed over for whatever reason. There seems to be a disconnect with who has purchased it and what the map shows. Just encouraging us to make sure that those lines of communication are quite clear. And then two, also, I know on some of our conditional use permits, we do require dust control from certain gravel companies and construction companies.
Correct.
So I think for the public to know that this is a different dust control requirement
Yep.
than what that is.
Yep.
All right.
And last year, we did work with GIS and printed out maps for all the blade operators for the residents that did spray.
Yeah, I think I didn't have any complaints last year. I just think that staying on top of it.
It has been an issue in the past.
Very good. All in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Thank you.
Thank you.
Just, I got, what, do you have guys have anything to do with beaver control and all of that? Or is that all watershed?
We've had plenty of beaver issues the last 2 years, and we just had one yesterday, actually, I believe.
Is that the one on Highland Grove? Or-
Yes.
Okay.
Yep, on 86.
Yeah, he's been working with me on, or been calling me and.
Yeah, we try to take care of it ourselves, but a lot of times we have to contract with somebody else because we don't have the means to clean out the pipe. A lot of times we'll have Jetway come in and spray them out, or we've used a couple different contractors in the past as well. And then last year we did hire somebody to start trapping beavers as well.
Okay, I was gonna say, that was my next question, whether anybody's trapping the beavers, because it
Yep, and we
doesn't help
plan,
to take the dam out and let them
yeah,
use the beaver there.
we plan to work with that guy again this year.
Okay. Very good, thank you.
All right, thank
Sorry
you.
for extending the meeting.
Thank you.
All right. right, so our next item on our agenda is Proclamation for Public Health Week. And I want to start off by saying that last week at our Joint Powers meeting, we were discussing I know we do a deal coming up for fire and all that stuff in May where there's Fire Week. And we learned of the National Public Health Week is this week, and what a better time to recognize those from our county public health department for the incredible work you've done this year. Just extraordinary and so a year ago so unexpected, and to step up to the plate, and what we're hearing constantly is the number of vaccines that you're now doing on a weekly basis is incredible, and it's getting us that much closer to getting back to some form of normal reality, and we couldn't thank you enough. So anyway, we have this proclamation, and it's from our county board and also from our Joint Powers group, which includes the city of Moorhead, the city of Dilworth, Moorhead Public Schools, and Dilworth Public Schools. And we're all sharing together in this proclamation, but I've asked for each member of our board and Steve to read a portion of it on behalf of all of you in our county public health. So Steve, do you want to start?
Certainly. Whereas Clay County Public Health is the practice of preventing disease and promoting good health, and
whereas since 1969, Clay County Department of Health has provided public health services to the residents and visitors of Clay County, and
whereas Clay County Department of Public Health educates and engages residents and community partners in order to become among the healthiest counties in Minnesota, and
Whereas strong public health systems are critical to sustaining and improving community health, and
Whereas Clay County public health workers deserve special recognition for their service, for the tremendous job they do, especially during the past year with the COVID-19 pandemic and difficult circumstances that they have faced, and should be recommended or commended by leaders in the profession, the public, and our elected officials.
And whereas Clay County Joint Powers Committee, which includes Moorhead Area Public Schools, Dilworth, Glendon, Felton Public Schools, the City of Moorhead, the City of Dilworth, and Clay County, is recognizing those in the public service they provide to our communities. And now therefore, the Clay County Joint Powers Board do hereby proclaim April 5th through the April 11th, 2021 as Public Health Week in our county of Clay in the state of Minnesota. And again, I want to thank you, and I believe we might have some others that wanted to speak. Do we have anybody online?
Shelley, are you there?
Yes, I am.
Okay. Oh, good. Mayor Carlson.
Thank you for giving me the opportunity to thank all the public health workers for their tireless work this past year. I really appreciated the Clay County Commission declaring this week Public Health Week, and appreciated the opportunity to sign on to the proclamation. The city of Moorhead and its citizens would not have gotten through this year without that tireless and endless hours put forth by the public health nurses. So thank you very much, and I hope they enjoy the wonderful week.
Thank you, Mayor Carlson. Oh. Yeah, so the last paragraph that says, in witness whereof we have hereunto set our hand and jointly signed as the representatives of our agents, each agency of the Joint Powers Committee in Clay County. And so this is signed by Brandon Lunick, the superintendent of the Moorhead Public Schools, Mayor Shelley Carlson, Brian Tygeson from the superintendent of public schools, and Mayor Chad Olson from Dilworth, and myself as the county board chair. And I think now after reading that, I think we should just we have a lot of public health people here today, and I think we should give them a big round of applause. All right. And I went and wrote on this thing that we had all our original signatures on, so. So I'm bad. All right. Yeah. Yeah, we can fix that. Anyway, I would like to make Colleen's job difficult, I guess.
Do we need
All right, so,
a motion on that, or do we?
yes, yeah, let's have a motion to approve that
I'll
proclamation.
make that motion.
Second.
Okay, Commissioner Gross, second by Commissioner Kaylee. All in favor signify by saying aye.
Aye.
Aye, opposed, the same, motion carried. And once again, thank you, and Kathy, it's your turn. Speaking of public health, we've been fortunate to have you come to us on a weekly basis to give us our updates and continue to provide important, necessary information to our citizens as we go through this. And Jamie here with you has also been very helpful. So welcome once again. And what's new on the COVID?
Well, thank you, Mr. Chair and Commissioners, and appreciate that recognition of, when Steve mentioned Public Health Week, Jamie and I were like deer in the headlights. We're so involved in COVID, just completely didn't remember about our Public Health Week. I just wanted to note some of the team. You see Jamie and I every week, and some of you have seen some of the Cheryl and some others at the vaccination site, but this is the group that makes everything happen.
Can we have them this morning? You brought them here. Can we have them just come up one at a time there, and maybe you can introduce them to us?
Sure,
And for the
absolutely,
public. I think
yes.
they deserve that recognition before we get started.
And of course, there's others back at the office
Yes,
that
well,
couldn't
but the
make
ones
it.
that are here,
The whole public health department gets involved, so everybody in public health has had some role
right.
in
But
the pandemic
I
response.
think we
but-
should see them today, and
And you remember Cheryl Sapp, who was
Yes.
initially with us, presenting information and updates. And of course, she is our key manager at our vaccination pod, and she is in charge of all the storage and handling of the vaccine, and she gets involved in many things in response. So whatever is needed to be done, she does it.
there's
So
not many county employees I would allow to stick a needle in my arm. But Cheryl, she was one of them, so.
she's a good shooter.
All right, well,
So-
thank you very much for all you've done. So,
Thank you.
yeah. Who else do you have here?
And Terry Bush is one of our public health nurses, and she's been involved in the response as well, again, doing lots of things, but really in charge of essential services that we've needed to provide out into the community. And she's had some other roles, but I forget what they all are. There's lots of them. And now, on top of a pandemic, just to note that we have active TB. So now Terry's going to manage that as well. Like, we have time to do that, but it's our job, so. That's right.
Well, thank you very much. You must have, I see a couple more here.
Yeah, Josh is. And Josh Ebert is, of course, our emergency manager. He's the key in making everything happen, and planning and organizing and connecting. He's part of our incident command team. He's instrumental in what we do, and of course, he has to write all the reports for MDH. So he's got a really big job. So he's a key for what we're doing in public health in response to the pandemic.
Thank you, Josh.
And Becky Schmidt.
You didn't know you were gonna all have to have a speech.
Yeah.
I said I'm making this go till 12.
Sorry, guys, I didn't know you were coming all over. Becky is, actually, she's with our food pool and lodging and she works with Kent, but she has epidemiology background, so we have pulled her in. She was involved initially with all the case investigation, contact tracing. She is doing a lot of our data information. She's, working with public information officer. So she's doing a lot of things in addition to her work with all the food pool and lodging establishments. So we appreciate her expertise in this. Thanks, Becky.
Cool, thank you.
Josh or Rory. What's your name again? Rory, yeah. Rory, oh boy, what can I say publicly about Rory? It's on the public. I'll be careful. Rory has been instrumental in, of course, as you know, with throughout the whole pandemic, with getting a location for people to be isolated and quarantined, especially the homeless and other populations. So he's worked tirelessly on that and independently on that, and also working with all the diverse populations, the shelter, all of those things, and so whatever beyond his work as a health promotion director. So he's been very involved. He's part of our incident command team. So whatever we ask of him, he's always willing as well.
So Kathy served on our CARES committee, and one of the things, Rory, that you were very helpful with in that process is you did an awful lot of research on our behalf in terms of where some of our good places to help the community in terms of using those dollars. So thank you for that as well. You were helpful. Thank you.
And he's also worked with, of course, the Fargo side as well, so has as a segment of that Red River Valley Task Force. In fact, most, if not all, of the individuals are on our Red River Valley Task Force. Rory has worked with a particular segment, particularly with the diverse population, so it's been great.
All right.
Thank you. And Jason McCoy, who will be also presenting today on another topic, but he has been pulled in also as well, working with public information in other areas that we need him in. So he's been, also looking at data and participating in some of our phone calls with MDH that we can't always get to, so providing the information in regards to that, media updates. So in addition to the other work he does, he's been pulled in to respond in this pandemic, and so we appreciate all of that. Thank you.
Right, well,
and then there's many others.
Yes, and be sure to
Yeah, okay.
recognize all the rest when you go back. It's
Yeah.
it's nice to see faces even though they were masked, but it's
Yeah, this is the team.
yeah, excellent team.
If we didn't have the team and then the others that couldn't be here and all of the public health, we couldn't have made it. We started in January planning our response as we were hearing about what was coming. So this is the team that made it happen. They get the accolades. So yeah, thank you very much.
Yes.
Thank you, team. Okay. Let's see, I guess we have to give some data. I sent some last week as well when we didn't have a board meeting, but as we look at the numbers this week, you can see that we are increasing with active cases, which we kind of had predicted a bit, especially with some of the events going on. We have sporting events, we have spring break, we have gatherings that are occurring, and so we're seeing an uptick in active cases, and we it's kind of across the many states and across the United States. There's a concern about the uptick. So that's happening here. So we're following that. It's increasing our work for our case investigators and contact tracers. So we're glad we have those individuals on board. As you note, our 14-day case rate also went up a bit. From 25.96, it's now at 29.95. That would be understandable based on the number of cases. And we're still seeing some increase in cases, so we'll be seeing this it's kind of been on the rise for a few weeks, so we anticipate it's going to continue a little bit. So because of that, we really still caution people. We're still in the midst of the pandemic. We still have it's circulating. We don't have the entire population vaccinated, so we don't have that herd immunity. We need to continue with our masking, our social distancing, and all of those things. Unfortunately, there's been a little bit of a lax as they're seeing across the nation. So we're trying to be very vigilant about that. We do have the variant strain that's circulating, and I mentioned that they did have the first case in Minnesota, but we have now a lot of it's the United Kingdom variant strain, the B117, and so it's now across all the states. Minnesota is one of the higher ones that have been detecting this strain. I think they're third highest so far, but as they do more testing, they'll find a lot more of that strain circulating. What they know about the strain is it seems to be a bit more contagious than the initial one. So it's going to be a little bit unpredictable how that will play out. But because of that, we need to be vigilant in what we're doing. So just a note on that. You see the active cases on the second page, and for this week, it's the 20 to 24 that's at the highest level. The previous week, we were noticing more the 15 to 19-year-olds and the 40 to 49-year-olds, but and that's going to vary every week as we look at our active cases. And cumulative cases are really pretty steady. And then we see our hospitalizations. We're still 89 deaths, which has been the same. In Minnesota, they're seeing a little uptick in the hospitalizations. And they're seeing that in other states as well. So that's a trend we're going to be watching. We meet with the Red River Valley Task Force tomorrow, so we'll find out what's been happening locally in our hospitals. Any questions on that before Jamie starts?
Commissioner Moore.
Thank you, Mr. Chair. My question had to do with hospitals and capacity, and thanks for stating that you'll find that out more tomorrow. Over the course of all of this, it seems to be, we saw a large amount of our deaths with those higher risk older populations. And just looking at the graphs that you provided and seeing that at least 72% of our older population has been vaccinated with at least one dose. It seems to be that that's really slowed the deaths that we've seen, as we haven't seen a death since the beginning of January. Are you, as we move out of this, whatever that looks like, in similarity to how we've lived with influenza, is that kind of what you're seeing, that even though we'll get some form of vaccinations, we'll still see COVID positivity rates going forward? It just will be how severe it affects certain populations. Is that kind of where we're coming out of this from an uneducated public health person?
Yeah, yes, thanks for that question, Commissioner Mojo. They are looking at and doing some studies on when will the booster shot be necessary, and what's the time frame for that. So there for sure will be, whether it'll be annual or more often than that. They haven't completely finalized that as they're studying, but you are correct. They believe that this will be around and it will continue to need a vaccine for that. And of course, they're working on vaccines now for the adolescent age. Right now, it's 16 and over, but they're working on a vaccine for the adolescents to reach those.
And I think, like you say, people are becoming vaccinated and they're still being careful, but there are activities that are now happening more than they were in November when we had our spike. And so in many ways, even though we're still seeing positive cases, it's maybe much less because people are more out and about. And so I'm not saying that we need to not be careful anymore, but I think we're learning how to maybe live with it. And I hope the trend with more people getting vaccinated continues, but we'll be curious to see. Hopefully we can keep the deaths at zero going forward.
Yes.
Just a follow up to that too. I know there's a county employee who's mentioned that they actually know of somebody who had both shots and it was past the 14 days and they've now tested positive for COVID. So it does happen. It can still happen. I think when those things came out, we were told that they might be between 90 and 95%, effective in a good way. I don't want to scare anybody by any means. The one good thing is I think currently anybody who's been, for lack of a better word, reinfected with it, I don't think that there's been any signs of hospitalization involved with those. So at least that's a plus. So that in the worst case scenario, if you did get it again, it's probably helps from it being too severe. So I still encourage people to get those shots.
Yeah, thank you, Mr. Chair. I know Becky has talked about even having some conversations with a few that have been reinfected as well, so it's happening.
So it does happen, and that goes to Commissioner Mojo's comments too, that, we still have to be cautious, but hopefully still in a more comfortable way than what we had to go through this past year. Okay, Jamie, you want to talk about vaccines?
And I'll add to that too. We have that conversation every year during flu season because people will start saying, oh, it's only 40%, but the issue is, and when you have your flu vaccine, it does prevent you from being as ill. And so it will be the same in this scenario. If you are ill, hopefully you will not be as ill as you would be if you were not vaccinated. So I think we just have to keep reminding people that it's not 100%. There are always exceptions, but you can do what you can to protect yourself and those around you by vaccinating and following those public health practices. Okay, so on to vaccine. We have moved to the point where we are now serving 18 and over, and we say 18, not 16, because we don't have the Pfizer vaccine in public health. And so we are encouraging people to sign up to receive a vaccine. And so I just wanted to note that that is on the website, the county website. And what we do is we export those to send you a link to register. So encourage people to sign up because that's where we draw from to get people signed up for the next clinic. We are averaging about 1,000, so we were just over 1,000 vaccines that we administered this last week. We've moved to the point where it's more of a challenge to get the vaccine used than it is to get it. And so that's kind of a new change for us. The big challenge, and I know Kathy's talked about this, but I just really want to stress that the 72-hour requirement of the governor is really what the challenge is. So what that means is we plan for vaccine clinics, but we don't get our vaccine until Tuesday, which means our clinic's starting today at 11. We have to wait till our vaccine arrives. And then we have to use it up within 72 hours. And so it's not very flexible for the community. And so that's the challenge because of that flexibility for the community, which is what we want. So we are constantly calling people and saying, can you come in for vaccine? So a lot of staff time is going into calling people to get them to come in for vaccine because of our 72-hour requirement. So
Jamie, if I can interrupt just for a minute. So I'm assuming that other counties might be experiencing the same thing. So what's the State Department of Health? Are they trying to encourage a change from the governor in that 72-hour?
Yes, and I can say that Kathy's reached out to all of our legislators. She's passed the message up the chain. I think sometimes it's just difficult to understand what the barrier is because it's not about the speed. It's about not having access. That's the 72-hour. We're able to carry 10% of our vaccine over into 7 days. So that gets us to Tuesday, the next week. So we've got a little bit to work with on Friday and Monday, but it's only 10% of that vaccine. And so that is not a lot. And again, the point I just wanted to make is it doesn't make it as accessible for the community when we have that 72-hour requirement to get the vaccine used in that time frame. So sorry, I got a little sidetracked, but I just wanted you to be aware of what a challenge it's creating for our staff and for the community to use that in that short period of time. But we continue to meet the challenge and we continue to use every dose of that vaccine. And again, a lot of time and energy is going into in the evenings and calling people, and we have lists of people that are waiting, but we need to get them there because the vaccine, and that's what's unique about this vaccine, it has a short window of once you've got that vial open, that it can be used. So it is time-consuming and a challenge to meet that requirement, but we've met it every time. Okay, so back to the stats.
Before you go on,
Really quickly, I noticed last week, it must have been similar to a situation where you're talking about where you had some that needed to get used. And I noticed that you forwarded it to some of the organizations that we partner with to send out to staff. And I think there are larger employers in the community, the county, that I think that will probably continue to be something that's beneficial for you to do, to get the word out, to continue to use all of the doses that we have available. But we will continue to advocate for more flexibility on that 72-hour. I think you're right, it stifles the opportunity to make sure we get that out. And it's too bad that it's a hindrance, but thank you for the continued good work on it.
And I think as we're, for the public to know, I do know that some of our pharmacies now in the Moorhead area are also offering vaccines, and some of them have been able to get the Johnson & Johnson one, which a lot of people like the one and done type of thing, but
Right.
so, if they can't go through public health through an appointment here, I would still encourage them to call their local pharmacy as well as another opportunity to get the vaccine, and especially as it's opened up now to more ages, so it's just another, and I know, I don't know if there's pharmacies in Hawley or Barnesville or whatever, but I would still encourage people to try to call those local pharmacies and see if they have that opportunity as well, so. Okay, Jamie, you can continue.
That sounds good. Okay, so looking at our data here for this week, the total number of people with at least one dose of vaccine in Clay County, 33.8%, Minnesota, 41.1%. Total number of people completing this vaccine series, 22.4% of Clay County population, and in Minnesota, 26.4%. And the people aged 50 to 64 with at least one dose, 42.4 in Clay County and 43 in Minnesota. People aged 65 and over with at least one dose of vaccine, 17.3% in Clay County and 82.5% in Minnesota. And then the total number of doses that Clay County Public Health alone has administered to date is 10,897. And we do look at the total number for the county and kind of scratch our heads because it seems like there should be more. And we all believe that there are more people vaccinated because they're getting vaccinated on the North Dakota side and have other opportunities. So we truly believe that number for Clay County should be higher, but we don't have the data to back that up.
So as I just mentioned, the local pharmacies on the Minnesota side, do they report those counts to the state, which get?
They're not required to do that. They report it at the federal level, and then the federal is supposed to come back to the Minnesota level. But we do not have that information.
So that 16,000 number in Clay County might not include some of those then as well?
It's supposed to, but yes, we believe that it probably doesn't.
Commissioner Moser.
Jamie, how does that, and maybe Cheryl can answer this better, but what does the Clay County Public Health yearly give in influenza vaccines? I mean, what's the number?
She also gave me that one.
Same.
So generally, and this is pre-pandemic, of course, we usually give anywhere from around 450 to 600 doses of influenza, and of course that includes pediatric as well, because we get state vaccine for children as well. So this past year, we did not give nearly as many influenza vaccines, but again, the good thing is if you look at the statistics for influenza for this past year, because people were social distancing, masking, staying home more, influenza rates were way down.
And I think I'm appreciative that you have that number because it's important for the public to realize that you've given 10,897 doses in the first quarter, a little more of this year. It's enormous.
It is.
Just one comment, Mr. Chair and Commissioners.
Yes.
when Jamie talked about, we give every dose out, we haven't wasted a dose. And we've worked really, really hard at getting that out in 72 hours, so we can meet that requirement of 90%. But Cheryl's been the key, because she will stay until the vaccine is gone. So she'll stay till 6:37 at night to make sure that we don't waste a dose and the vaccine is given, and without complaining. She's just always willing, throughout this whole pandemic, to make sure that we get those doses out, and calling and trying to get people over there. So she's been working really.
Yeah, I agree with that, and I think you've even had a couple of times where, it seems to me, didn't you have some after-hour openings too for, I think when you were giving the vaccines to some of the educators,
So generally, with the Moderna vaccine, it comes in a vial of 10 doses. And if we have a person that is late to their appointment for our clinic over at the Yum Comps, we'll have to open a vial to give them their dose. Well, that could potentially leave us with 9 doses left. And in all good conscience, as a public health nurse, I cannot waste anything. So we have tried to create lists for people that have called public health and said that if you have any extra doses, there's been times at the Yum Comps when we've had up to 25 people waiting at the end of our clinics to see if we have them. But because the opportunities have increased with healthcare systems and pharmacies, and allowing people to have more options to get their vaccine, those lists are dwindling. So I may have Kathy call each of you if you know of people who haven't been vaccinated and would like to be, if we have those doses left over.
very good.
And that's good news, because it's getting to be a challenge. We had people that were waiting, and we have a team that puts that list together, but the good news is it's become a challenge for us to use those doses, and it's time consuming and stressful, but it means people are vaccinated, so that's the number one thing.
Do you want to continue, Jamie, or were you
I think I'm good.
wrapped up? I'm just trying to,
I have
cooperate with Frank.
one other question, I'm sorry. Thank you. I know we've heard a lot from the governor in terms of what his threshold is for reducing some of the regulations. And as I see that on here, 26.4 of the state population has completed. What are you hearing, if anything, in terms of that?
Basically, as they're talking about relaxing things, they're also reminding people that we do still have a lot of what you already shared this morning, is that we need to be aware of the fact that it is still circulating in the community. So we're moving cautiously, but optimistically.
And Mr. Chair and Commissioner Mojo, they also have, and you may have seen that on the news, they've designated some extra state vaccination sites. So they're trying to saturate some more. I think the State Fairgrounds was just the last one. There's many vaccination sites in the metro area. So he's trying to have the ability to push out a bit more. And when he opened it up to the general population, there's so many pockets in areas of Minnesota where they were just sitting. They had no other people in those particular phases, so it was pretty inequitable. So to open it up so some areas can really kind of move forward and push through their vaccine was a good thing. So
I think, and just to follow up, I received the Johnson & Johnson and at one of the local drugstores, and I was informed by the person giving it to me that over 50% of the vaccines that have gone out of there have been to people from the metro. And so I think it's important for the public to know that Clay County citizens, that there are those doses available locally, but they're also being used by people from elsewhere in the state, which is okay. But I think that Clay County citizens should have first dibs at it personally.
So as we wrap this up, there's something else that I want to make sure that will you please give our thank you, and this proclamation also applies to those that were working the contact tracing. I think they need to know. And then also you've had an awful lot of, I think you've brought in some part-time nurse students and what have you to help give those vaccines and make sure that you send them a thank you on our behalf too. The proclamation also goes out to them. So if you would do that for all of us, it would be great.
Thank you, Mr.
Commissioner,
Singleton.
excuse me, Mr. Chair Campbell, I also want to include our volunteers
Yes.
at our vaccine clinics. We've had a number of volunteers, from retired folks to college students that have come and assisted us with making our process over there very smooth. So
Absolutely.
I want to remember them as well.
Well, they all made, are making this a lot better for us, so.
And we would be amiss, Mr. Chair, if we didn't also mention our emergency manager. So Gabe has been with us from the
Oh, yes.
beginning
Yes.
and been involved in our incident command team. And then the emergency manager from City of Moorhead has also been very involved, and of course was the one that kind of reached out about the YEMCOM Center. So they've been instrumental in working right along with us, and they're a valuable member of our team.
So you're, Kathy, I remember a couple of meetings you coming in here and you were kind of stressed. And it's very nice to have you come here and report and with a nice smile on your face. And
Thank
so
you.
obviously
Yeah,
things
had my
are.
moments.
Yeah, well, yeah, but well, again, you all have just done an amazing job, and we just want to thank you. So.
Thank you.
And
Okay.
I get the sense that there maybe is a little bit of relief from you folks in public health. Maybe?
A little bit with the vaccine. Well, maybe Cheryl can't say that, being in charge of the vaccine. But, yeah, we're seeing some progress.
I would say we've just learned how to adapt.
All right, okay.
We have
I'm
to
not
laugh.
suggesting that your work isn't over, but
Yes.
thank you all very much.
Okay, thank you.
Thank you.
Thank you.
All right, Frank, I'm only 7 minutes over.
Yes, 7 minutes, let's just check.
All right, our 9:15 item at 9:22. Solid waste. We
Thank you very much, Mr.
have
Chair.
a couple things for us.
As a resident of Clay County, City of Moorhead, I want to thank the public health folks as well. I mean, I think what they've done has just been phenomenal. And I certainly appreciate all they've done, and it's beyond me why people aren't getting vaccinated. I hope like hell they do. I think it's pretty important to be done, so not only for themselves, but for the community as a whole. So that's my editorial comment. Thank you.
Item number A, approval of the,
Thank you for moving me along, because as you know, I can talk myself into a deep trap very quickly. I came before you today with two items. The first item I came before you with is it's outside the budget, and essentially it's $6,900. PCA, we have a new hydrologist I came and talked to you about before. The hydrologist is not real familiar with our facility out there at the landfill, and she's asking for some additional testing. These additional testing will be outside, primarily outside of the landfill. It'll be done in conjunction with the spring sampling that we are doing probably about the 19th of April. Hopefully it's a one-time deal, so the hydrologists will get comfortable with what we're doing out there. We've had some issues out there in the past, but we really don't have any issues right now. So with that, if there are no questions, if Commissioner Gross would like to offer a motion, I think it'd be appropriate.
you're the go-to guy.
Well, I will certainly make a motion to approve this item.
Second.
All right, we have a motion by Commissioner Mojo, a second by Commissioner Kaylee, and I just want to comment that thank you for bringing it. I know it's beyond what we approved in your original budget, so it's glad that you came with that, so.
And I just want to comment on that, please. Thank you, Mr. Jerry. As member of the SWAT committee with Commissioner Campbell, I really appreciate that you have brought in Everett as part of that. He's been helpful in coordinating with landowners. I know that it's definitely a tricky balance with making sure that we're being good neighbors out there, and I think that doing these additional groundwater samplings is certainly a way to just kind of ease some of the concerns that those neighbors, but also ourselves may have. So thank you for coordinating that.
Excellent. Okay, we have a motion and a second, right? All in favor signify by saying aye.
Aye.
Opposed, the same sign.
Mr. Chairman, the second item I came before.
Motion carried.
Oh, I'm sorry. I'm considerate of Commissioner Gross. We want to move this along, you know, so. The second.
I'll do that.
Okay. I'm trying to help. I'm trying to be helpful. The second item I come before you with is the Prairie Lakes, and Commissioner, or Mr. Chairman, you may want to speak to this probably more than I do. But the Prairie Lakes has an opportunity to refinance some of their bonds that they have at a lower interest rate. And when I wrote this original board item up, I didn't have the number from, the exact number from Prairie Lakes, and since then I have that number. And it looks like through the refinancing that would be done, they would have an opportunity to save up to $1.6 million, which is a sizable amount of money to be saved. As Commissioner Campbell mentioned at the Prairie Lakes meeting, if that came here, that opportunity, he'd be very quickly first in line to make the motion to approve it. So with that, Commissioner, Mr. Chairman, if you have some other things to add.
I think you've, you know, I think that, and just so the board knows, that 1.6 million is a net savings after the costs associated with doing the refinancing. And had we, so that includes, there's going to be, so the money's going to come in, we can't pay up, the bonds aren't callable until, I think it's November of 2022.
That's right.
So that money is going to, that bond will be sold and it'll sit in an account waiting to be able to recall the other bonds. So we're paying double interest on it up front, but at the same point in time, that 1.6 million is net. And it was anticipated that if the rates were to stay the same, and we just waited to do this in November of 2022, we would have probably seen about another $200,000 benefit. And we just felt that it's very unlikely that these rates are going to remain stable into November of 2022, and we felt it was, let's get that 1.6 million and run. And so that's, I think that was the view of the entire Prairie Lakes Board as well. So we do need to have a motion to approve the refinancing of the bonds.
Move to approve refinancing of the bonds for Prairie Lakes.
Second.
We have a motion by Commissioner Cayley, second by Commissioner Ebinger. Any further discussion?
I'd just like to make the one comment. This could put you in the running for Department of the Year, though, so. I mean, that's a big saving.
After Kathy.
Mr. Chairman, Commissioner, you haven't seen the rest of my budget, so.
Yeah. Yeah.
That was a good one.
I'll remember that comment, though, believe me.
Okay, I think.
He's also told that to every other department. If that means anything to you.
You mean I'm not the only one? I'm crushed.
All right. Well, thank you, Kirk, and all in favor of the motion signify by saying aye.
Aye.
Okay, and you're going to hang around for a little bit for
Yes,
another item?
yes, I am.
Okay, thank you, Kirk.
Thank you.
Yep. All right. Look at that. I've gained 3 minutes. We're down to 3 minutes. 9:25 item, information on proposed upgrade to tobacco ordinance. We have Jason and Rory are coming up.
Plug in here.
Yep. Yes.
Well, that's about all I can tell you is yes, because other than that technology, it's not my thing.
That's actually a vaping device.
All right, who's going to start?
I'll get us rolling.
All right.
Good morning, Commissioners. Thanks for allowing time for us to share a little bit, some updates. You know, in public health, we use a phrase, social determinants of health often. Our work is really to look at those environmental things, those cultural things that we might be able to influence to make it easier for people to make healthy choices, whether that's regarding physical activity, eating well, or avoiding the use of tobacco. And certainly, one of those things is looking at opportunities for policy to, in this case, reduce access to flavored tobacco. And we have the good fortune to have on our staff, I think, really one of the regional tobacco experts. Jason McCoy has been with us for the last 6 years. He's been working on this. He's worked in Otter Tail, in Wilkin, in towns around our health improvement area, and has had a lot of success improving tobacco policies, knowing that there's nothing healthy about it. And so he's our guru, so he's going to take it from here and share some updates on tobacco use in Minnesota.
Thank you, Commissioners. So just a real quick on the our bullet points there, made it sound like we were going to actually talk about the ordinance, but I was supposed to give an actual presentation for the public, so that's what I'm going to proceed with. And if you have any questions specifically on ordinance, we'd be happy to answer them. And then also, it's always fascinating. So please, if I talk too fast, let me know to slow down, because as you all know, I can talk about tobacco for 45 minutes to an hour, and I'm supposed to go for 15. So
Right. Yeah. Well, yeah,
So,
you can watch that little
I'm
bit.
watching the time. So
Okay, so just as we get going on this, for today, this is information for the board.
Yes.
There's no planned action on this today, just so that
Correct.
the public is aware. We'll have time to have more dialogue on this after your presentation, but.
Absolutely.
All right, feel free to.
All right, thank you so much. I like to start off by just pointing out that nothing that we're going to talk about here deals with sacred tobacco specifically. Sacred tobacco here in Minnesota by the tribes is actually red willow bark. It is not the tobacco plant, and that's important to notice. It's also part of their religious beliefs, and as such, we do not recommend any kind of legislation around that, and in fact, we celebrate with them.
Just a question on that. I know you stated the tribes, but there are other immigrant populations within the communities that have voiced some concerns with that. How does that play into the sacred?
Excellent. Would you like me to get into that, or I actually have it built into the presentation?
Is it part of the presentation?
It is, absolutely.
Okay.
Because a great question. Building off, what we are talking about is commercial tobacco. So commercial tobacco has for a very long time been cigarettes, cigars, and smokeless. And then in 2016, the federal deeming regulation was passed, and that included e-cigarettes, or more commonly known as vaping, and it also included hookah. And the reason why is because all of these products contain the tobacco plant itself. And we'll deal a little bit with that as we go forward. Specifically though, here, it's supposed to say hookah, I apologize. Although I do like the fact that one of the things that it's also called is hubbly bubbly. I thought that was kind of fun. But hookah specifically, most of us here in the upper Midwest have never seen hookah. It is a growing trend in the United States. It has its origins as far back as perhaps India. It's kind of lost in history. However, it is primarily used by two main groups. One here locally in Minnesota, one would be some of our new American, specifically Arabic partners, and then it's also used in the college crowd as well. In fact, the #1 growing use rate for hookah is amongst college students. And so there's a growing popularity in hookah bars or lounges, kind of like think about like cigar lounges and things like that of the past, where secondhand smoke becomes quite an issue. I did a lot of research on this because, we haven't had to talk about hookah that much here. And so what I found from the CDC and from the American Lung Association is that research shows us health-wise that a 1-hour session of hookah, which is very commonly used, you sit and use the same device, and as you can see here, it has a mouthpiece, and then it's mostly a water pipe that is used with charcoal burns, and they use what's known as shisha. Shisha is a tobacco mixed with honey and molasses, sometimes some different herbs and things like that. And so what it ends up being is a 1 hour of hookah use is the equivalent of chain smoking 5 packs of cigarettes in the same hour. And so quite a bit of health risks. Those are very unknown, even amongst the community. As we have been trying to bring this information forward, we find out that quite a few people don't know that it's actually causing this kind of problems because as the smoke passes through the water, it's believed that it takes some of those particulates out of the smoke. And in fact, it doesn't. It just makes it a little bit milder to the taste and to the lungs, so it's easier to inhale the product. Also, there's a great fear of risk of communicable diseases. Anything from tuberculosis to meningitis can be passed mouth to mouth as you're passing this around, but especially when we're talking about COVID, some of the most recent research is very COVID-centric in that if a person has a respiratory illness, you can very easily pass it to the next person in the room. And I'm going to get to some more research that was built into this later, where we see that COVID very much damages the respiratory system and opens the door for all forms of tobacco or any other respiratory illness to come in. So you would ask specifically about other cultures using this. Yes, to say that other cultures use it as a cultural practice is very, very true. That does happen. And it's always a very interesting path to walk down when we're talking about, from a public health perspective, right? Because we think about all smoking was traditional for a long time. I mean, right here in Minnesota, a lot of our hunters choose to chew and things like that, and it gets passed down person to person. And so we've been having conversations with our New American partners about this and trying to ask questions like, we don't want to leave any children behind. Number one is when we talk ordinance and policy, we want the best health effect for everyone, we want social justice for everyone, right? And so whenever we look at any form of a product that is this damaging and this deadly, we have to consider what is the best policy versus will we leave a certain group behind and allow health effects to be left there in their population as well. So we're definitely trying to help with education and trying to partner as well. So rolling forward from there, it's important. The last 6 years, I've gone from talking about cigarettes to talking about vaping almost entirely. And I realize as I've been having these conversations, it's very important to just remind everybody that tobacco is still public enemy number one. 480,000 deaths a year in the United States happen. That's more than the combined totals of death from AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. And that's because carcinogens are built into the tobacco plant. And a lot of people don't realize that. That's the reason why we have problems with chew, for an example, versus smoking. Certainly, the combustion of the tobacco product provides far more chemicals to be inhaled, but any form of tobacco actually carries these carcinogens into the body. And so it's important to just keep that in mind as we go forward, because it's very easy to see vaping as the new bad guy, and really it's a tobacco company that's morphed into a new version. They're still selling the same products, right? They're still selling them to kids, and that's the thing that really concerns us. But just definition-wise, we talk about flavored tobacco, and it's really simply anything that tastes and has something added to the product that's different than the original tobacco plant. And so it can cover any of these kinds of products, certainly vaping, but we have menthol cigarettes, we have flavored cigars, flavored chew, and all of these products have been made to be specifically attractive to youth. And made by the company who gave us these wonderful quotes. For those who perhaps can't read them, the basis of our business is the high school student, said one executive. We don't smoke that for public, I won't say the word, we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid. And that was from R.J. Reynolds, who is still selling these products right now. And then Cherry Skull is for someone who likes the taste of candy, if you know what I'm saying. These are some of the more palatable things that I can say. I don't think they are palatable at all, but tobacco industry has always been a multi-billion-dollar industry. They're made up of 3 major corporations with small offshoots. Almost every tobacco product comes out of this chain, and they keep attracting kids. Here in Minnesota, we thought we had it beat. We thought we had Minnesota on the way out from under tobacco's shadow. We were down to about the 5-6% smoking rates, and then vaping brought it back, right? As of 2019, you can see in 11th grade, we had 26.4% vaping use. But here in Clay County and rural Minnesota in general, those numbers far exceeded the state average. In fact, we have one school district that were as high as 43% vaping rate in their junior year. Now, 2020 just gave us the latest Minnesota Youth Tobacco Survey numbers, and we had one piece of good news in that the once in 30-day use went down to 20% off of that 26% as a state average. However, the daily use went up to over 33%. So that means more than 33% of those choosing to vape were vaping every single day. And so that points to high rates of addiction. And we did ask these questions in this survey for the first time and found out that 75% of those who were vaping showed very high signs of being addicted to the product. So there's a lot of work when it comes to cessation. We also see this in our young adult population. So in the 18 to 24-year-old grouping, we saw vaping more than double. We're over 22% at this point in time. And a lot of times the vaping companies try to say that they exist to be cessation. They have A, never even applied to be a cessation product from the FDA, and B, these youth, as you can see, 75% of them never touched another tobacco product. So instead, we're seeing that this is something you start with, not something that you end with. In fact, when you follow the data, it shows that if you're over the age of 24 and you're a tobacco user, you're less than 5% likely to switch to a vape. Now, how does big tobacco do it? We know tobacco kills. We've known this for so many years. DARE teaches our kids in elementary school. Most of them won't touch a cigarette, and yet it's the same as it's always been. It's the media, right? It's the way that they can attract people in through advertising. And I mean, when was the last time any of us saw advertising from the tobacco industry, right? 21 years ago, we had the big lawsuit settlements that knocked all of that out of the media. The FTC won't air a radio commercial. It won't do a TV ad on cigarettes. But vaping has slid under that window right now. And we now have social media. And that's where most of it's at. So as you can see the numbers, $110 million gets poured into Minnesota every single year in the form of advertising alone to bring tobacco to our kids. Now, when we talk about social media, we have to think about the whole nationwide budget, right? Because we could be making posts here for Florida or vice versa, and then you have $23 million a day spent. And so when I have a free moment, I like to think about what could we do with $1 million an hour, right? What kind of health benefits could we have? And that's what's pointed straight at our kids. Most of these are social media ads. The advertising comes through social media now as well. And oftentimes it's very, very targeted. It looks like something like this, or like these pictures that I had on my previous slide here as well. They're made to look like you. Now, there's a reason why 9 out of 10 black smokers smoke menthol. They're very much targeted by the industry. And because of that targeting, it's smoking, menthol smoking specifically, is the #1 cause of death amongst our African-American partners. And that goes all the way across flavors. Flavors make it twice as easy to get addicted, twice as hard to quit, because it ties into the pleasure center of your brain, right? And so you literally find yourself unable to enjoy something like you would have without the presence of that tobacco in your system. And then, of course, all of this has led to some very tragic consequences. So when we talk about vaping specifically, I've given you the smoking number, so this is separate from that. Starting in 2019, right before COVID came about, we started seeing that all these deaths happen amongst young people that had been vaping, some of them as little as 30 days. But the thing is that vaping makes a cool mist and not a hot smoke. It's very easy to use. And so young people can go from their first puff, instead of coughing and choking like they might have on their first cigarette, they go from their first puff to using their first pod of Juul, which would be as much nicotine, as much tobacco as is in at least a pack of cigarettes. And they can escalate. We had a middle school student right here in the last month that was caught 6 times vaping. He was using as much tobacco product as would be in 6 packs of cigarettes. He hadn't been vaping for more than a year. You know, it's hard to become a 5-pack-a-day smoker. It's really easy to do that with vaping. And so what happens, to not go too deep into this, is we've found that vaping causes chemical burns in the lungs. So it doesn't have the tar like cigarettes does. And that's why people think it might be safer, because you don't cough that tar up like you would if you were a smoker. But instead, you're getting these chemical burns. And it comes from vitamin E acetate, which is in the liquid. It's in the liquids for nicotine vaping. It's in the liquids for marijuana vaping as well. So both sides of that fight try to point the finger at each other, but ultimately they both use this product. And the best way to explain it, I guess, for the public would be if you consider sizzling fat in or oil in a pan and it pops and sizzles, it might burn your arm. And then your body will make a water blister around it to heal. That's what happens in your lungs. And so as you can see in these pictures, these big white bubbles are actually cysts of water in the lungs. And if we can reach the young people before they get this bad, we can drain those. And if they'll stop using the product, and I'm going to use air quotes here, all that happens is they will have a lifelong scarring in their lungs. And we don't know what that means yet for them in the long term. Right now we're going to be learning that for the rest of our lives as we do research. But what often happens is these end up drowning the individual. And that's where we get the deaths. We've had our first double lung transplant over in Wisconsin even, on an 18-year-old. And then I promised you information on COVID as well. So research, of course, turned whenever something is in the media and happening right now, we need to know how it affects public health. And so what we have found, we always knew that tobacco would lower your immune system. We've proven that vaping does the same thing, just like cigarette smoking. And so to put these really quickly, it doubles the rate of progression of the virus if you actually manage to contract COVID. It doubles the rate of worst case symptoms, and it makes you 7 times more likely to catch the disease. Really, I think about it like this. If you kicked your front door in, you would expect anything and everything to come in your front door. That's what vaping and smoking does to the respiratory system. It literally destroys it and allows you to get anything from the common cold on up to COVID. Nicotine is the addiction. It's important to point out that nicotine is not what kills you. It's what keeps you addicted. And that's important when we talk about various levels of some of these products. For example, to circle back to hookah, it has less nicotine than a cigarette does. So that's the reason why you might only use it 1 time a week for an hour, because that addiction doesn't kick in as easily. However, it's the tobacco part that kills. The nicotine keeps you there long enough for the tobacco to do its dirty work on you. Now, when we're talking about kids, what nicotine does do is it slows down the development of the prefrontal cortex, so the part of your brain right here behind your forehead that becomes who you are, your risk versus reward, your decision-making process. It's all there. I was talking to my 15-year-old daughter explaining this, and as she said, she's like, that's why teenagers make some dumb decisions, huh? And I'm like, yeah, that's exactly right. That's why we get some questionable decisions, and we hopefully grow up by the time we're 25 when our brain is finished crystallizing. Nicotine slows that down, and when I talk to teens, I tell them this isn't like skipping out on your diet or skipping out on training. This is not something you can catch back up. There's no amount of Sudoku you can do to bring your brain back up to the level it would have been if it hasn't been slowed down by these products. And then let's close off with Blue Cross Minnesota did a productivity study. So I gave you numbers for the nation, but it's always more important to see locally. And we found that $7.5 billion in excess healthcare costs and lost productivity happen in Minnesota every year from tobacco use. Now, to make that really personal, here in Clay County, $753 per household of our tax dollars go to support this loss in Minnesota. So whether you're a smoker at home or a vapor, chew, your household is helping pay for someone else's illness and potentially, sadly, death. When it comes to regulation, there's 3 levels. The national law regulates what is tobacco, controls sales across state lines. They have said that tobacco sales can only happen to 21 and older. At the state level, Minnesota has raised the age to purchase tobacco to 21 as well. They provided us with clean indoor air and regulate tobacco taxes. And then the rest falls to local municipalities. We regulate what can be sold and where it can be sold, and anything else for the health of our community falls to us. That's the reason why we've been talking with you and other municipalities in the area about what we can do. And thank you. I think I just barely went over 17 minutes, so.
Any comments today? All right, well, we'll come back to this subject another time. Thank you for your report. All right, Steve and Brian and Joe and Kirk. I think you all gonna maybe have, yeah, Brian, you can comment from there, yeah. All right, as you know, we've been working on an exchange agreement with the city regarding the landfill, or the transfer station land site. Steve, do you want to start this off?
Certainly. Thank you, Mr. Chair, Commissioners, and good morning. We are excited, I guess, to bring you this potential exchange purchase agreement for your discussion. This agreement involves both county and city owned property, the DMV site on 15th Avenue, and also the land which Kirk Resource Recovery Facility is going to be going on later this spring. This agreement kind of came through a discussion from our building committee led by Commissioner Campbell and Commissioner Gross, and also a partnership with the City of Moorhead and Councilperson Hendrickson and City Manager Dan Molly. And so we're excited about this presentation today. And again, if you have any questions or comments as we go, we have three main sections of this, and we'll have a pause in between each to ask additional questions, but please stop me as we move forward. Again, here's our overview. We're looking at, just to kind of give an overall background of Kirk's resource recovery project, I think is important because that's really where this came from, at least in initial discussion. I think it's beneficial for our new commissioners also to hear a little bit about that. We're going to touch on the exchange and purchase assessment, agreement assessment, and working together. And a part of that is this change is going to require some additional storage space for the county. We utilize about 5,400 square feet of storage out at the DMV site, and so Joe Olson is also our 955, and so we're going to actually kind of combine that if it's all right with the chair, because I think that you'll need that information to make both of the decisions. Then we'll have contract discussions, and then also any follow-up questions. And so, as I mentioned, the Resource Recovery Center is kind of what spurred this. The City of Moorhead worked through Kirk probably earlier this winter, and I don't know if you have any comments on that, and brought this idea forward to us. And so this picture here, as part of their project and in working with the PCA and the legislature, they formulated this video, and I thought that would be very nice for us to see this, and so I'll try to get it up here without messing up too bad here, so. That worked when I practiced earlier. There we go.
Clay County, Minnesota takes pride in being an ideal place to live, work, and raise a family, and it has for more than 160 years. Located along the Interstate 94, Interstate 29, and U.S. Highway 10 corridor, it offers a welcoming hospitality to thousands of visitors every year. This reputation, our way of life, will continue to stand strong. In 1975, the county was home to roughly 47,000 residents living within 11 cities. Today, it caters to nearly 65,000 residents. To meet new demands and improve community services, infrastructure upgrades are happening countywide. However, the Moorhead Solid Waste Transfer Station remains the same. At 2,500 square feet, the existing transfer station, which receives garbage from residences and businesses and transfers it to the landfill or Purim Resource Recovery Facility, is in desperate need of repair. Located in Moorhead, Minnesota, the county seat and largest city in northwest Minnesota, the station is run down, its electrical failing, and it doesn't have sufficient capacity to properly serve a sprawling county. Instead of dumping $1.5 million into an outdated, undersized transfer station, Clay County came up with a more efficient plan. A new solid waste campus, one designed to serve the cities and counties' solid waste and recycling needs for decades to come, will deliver improved public services to citizens while increasing protection for the environment. Providing the convenience of all these services in one place, the new Clay County Solid Waste Campus will include a 10,000 square foot transfer station, a 10,000 square foot drive-through public drop-off area for waste, recycling, and problem materials, a 3,000 square foot household hazardous waste drop-off, a 7,000 square foot office with community meeting room, and a 300 square foot scale house. Equipped with the necessary space, the new transfer station will allow more waste, in all sizes, to be shipped to the Purim facility, turning it into energy rather than burying it in a landfill. A solid waste campus of this caliber, which can be built in a quick 12 to 15 months, also can help in achieving the next step in Moorhead's Green Step City initiatives. By investing in our infrastructure, we're investing in our future. And with the right support, the right improvements, and the necessary investment, we can play a part in improving our county, its resiliency, for tomorrow's residents and visitors.
Steve, just real quick, Kirk, can you have that video ready for our next Prairie Lakes meeting? I'd like to show it there.
Yeah, we'll definitely have it ready. That video is about, it was done at the request, basically, of PCA. They used the video in conjunction with dealing with legislators.
Okay.
I think it came out really well, so I'll make sure that it's on the agenda.
Good, thank you.
And I think it's important to say, had we not be bringing forth this potential exchange and agreement, Kirk would be here asking to purchase this property anyway. And so just to kind of give a project timeline, just briefly, in 2016, Clay County and the city of Moorhead began to make a collaborative effort to request funding from the legislature. After vetting multiple locations, the city of Moorhead purchased 20 acres of land for our future site. After a great deal of work from many of the commissioners on this board and the work of Kirk and City of Moorhead representatives, in 2020 we were successful in being awarded $7.5 million in bonding dollars from the state legislature. And Kirk spent pretty much every day since planning to get into the ground this late spring, early summer. And so, again, the original plan was for the solid waste department to purchase 17 acres of the 20 acres from the city of Moorhead, and that would have been roughly the cost of $463,587.87. If you take a look, this is the original footprint of that transfer station location. If you look on the far right side there, you'll see roughly a 10,000 square foot building with a couple parking lots. That was where the portion of the project which would be utilized for storage for the city of Moorhead. Any questions on the resource recovery portion?
Just to point out, so the original plan was to buy 17 acres. The city was going to keep 3 acres to maybe build somewhere in the area, $1.5 to $1 million facility of their own. And now through this process, which we're getting to in the exchange, that's where they no longer developer would need that if they got the 15th Avenue property, and that allows us then to buy the entire 20 and have some room to do what Joe's going to be talking about. So, a little recap there. Okay.
Sure. And then we'll move into the city-county exchange purchase assessment process. Again, like I mentioned, Kirk brought forward this idea from the city of Moorhead this past winter. The city of Moorhead inquired about what plans we had for our property that formerly housed the DMV. Currently, it does house the Minnesota State Testing. Again, we have about 5,400 square feet of storage out there. That's for the sheriff's department, Joe and the maintenance department, and also the sentence to serve. Kirk's Electronics Recycle Building is there, and we also have a public health building, which is not here, but is located up in the right-hand corner there. Well, currently, we have operational costs of this building of about $30,000, and we have an annual lease agreement with the state that we have received just over $15,000 in funding. We did vet a number of different ideas from a county standpoint and talked about some possibilities, but currently there's no plan under our current campus master plan to do anything with this building. The city of Moorhead currently operates its public works department just 2 blocks to the west, but they're having some challenges from storage space, but also a need for some additional office space. And so we discussed some of these benefits to both of our agencies. On multiple occasions, we met with our building committee and also, again, Dan Mawley, councilperson Chuck Hendrickson, and many other city of Moorhead personnel. They toured the facility and were very pleased with what they had seen. And so we began to meet again and have some additional discussions about a potential sale negotiations. Again, we felt like this was a very good partnership for both the city and the county. And really, realistically, the big winner here in this agreement would be our taxpayers here in Clay County. I think one of the important things, as I mentioned earlier, is that in the event that we would exchange the property, we do have storage space needs that we would need to relocate for our needs. And as Commissioner Campbell noted in this process, the city of Moorhead, if we were to do this exchange, they would no longer need the 3 acres at the landfill site, or excuse me, resource recovery site, which is why we have Joe here to talk a little bit, talk about what that solution could be.
All right, Joe, let's hear your plan.
Okay. So basically, the Clay County proposed storage facility project is what I'm talking about, and the current storage space at the existing DMV site is 54,002 square feet. The proposed space and current needs would be 10,000 square foot building. If you look kind of to the right on that picture, that's the actual size over by the pond there of what that would look like. And the current retention pond would design for future growth in the conjunction with the solid waste resource recovery project.
So can I just go back to that? Sure. Just real quickly. So in the original plan, where you see on the map there, the 3 acres that the city was going to use for their storage facility would have been to the north of the current transfer station. They would have taken the 3-acre strip to the north. In talking through our committee, we felt that this is a separate deal on behalf of the county, and we felt it would be important to stay away from the access point from the transfer station. And so under this particular plan, the entrance for this facility would come off of 15th Avenue. And if you noticed where the little storage building is there, there's an awful lot of still open room. I think you've got some sort of a hash marking there. That still remains land that could be for future use. Certainly, I think the area straight west of the transfer station, it'd be nice to kind of keep that kind of reserved for the needs of the future transfer station area. But certainly there's that area to the south where the county would have some other opportunities down the road if we so needed. So I just wanted to point that out, and that's kind of why the plan is to put that facility where it's at right now, so, right? And that's been discussed, Commissioner Gross, through our building committee, that would be the appropriate place to have that, so. And I do want to add, you said we were going from, what, roughly 6,000 to 10?
10,000, yeah, it was 5,000.
And,
5,000.
and of course, that was in consultation with our sheriff's department, STS, replacing the public health building through CARES dollars that we had, and what else? And then of course, the county's, your needs.
Yep.
And I know as this facility turns more into a justice center, Lori from the auditor's office has an awful lot of voting stuff and records that we kind of wanted to incorporate some potential space over there for that to ultimately move. So we were looking into the future, that's why it went to 10,000.
Yes, correct, yep.
Yeah, we were looking at proposed future needs. Commissioner Moschel.
Thank you, Mr. Chair. Since you did point out that the public health building was purchased with CARES Act dollars, can we just talk a little bit about what the requirements and the guidelines are in terms of, you know, I think it's vitally important that public health has that facility for what the COVID needs will be in the future, and can you talk about the timing of that, please?
Yeah, I think either whether during the exchange purchase agreement piece, I mean, we can talk that over, but I think we can talk about it now. I mean, we've gone through within the purchase exchange agreement. It'll go in effect January 28th of 2022. So it's fully in compliance with the CARES Act and allowing for the exchange. It'll allow for use of the CARES dollars that we had originally done and got a public health building, and now really all we're doing is getting a new public health building. It's really the same square footage. It'll still allow for public health to have proper storage for their equipment and their needs, and it does comply and will comply with the CARES Act requirements. So I think it's in full compliance with the law and with everything that we're doing here.
Thank you.
Does that satisfy your?
Right, yes.
Okay, right. Okay, so Joe, what else do you have for us here?
Just got a little bit more here. If you look at the screen there, you can see that basic layout to the left there. It's a 50-foot deep by 200-foot wide garage space there. And like Commissioner Campbell said, that miscellaneous storage that we have in there, that's to we have a lot of miscellaneous needs around the county that require storage, including the auditor, so that's what that was added to, so.
Joe had actually presented something somewhat smaller in our building committee through our discussions and looking at future needs, we actually asked you to add that.
Yeah, right, yep.
So
Yep. So the objective is to replace the storage needs at the old DMV site if we conduct this land swap. So the location is of course set right over, it's right where the map shows there. The storage facility, this building will serve as a joint facility satisfying current and future needs for sheriff's maintenance, public health, and sentence to serve departments as well as county needs. This facility is 10,000 square feet, so, and it will be heated along with some cameras and some card access, so. Other than that, as far as the actual cost estimate, we have a ballpark rough cost of $600,000. It's tough to put a number to that exactly right now, so in our action plan today, later on, I would be requesting board approval to have construction engineers design a plan for us. It's gonna cost $2,500, but they design a plan and bring a proposal to us. And then when that comes in, the building committee would then review it, and then ultimately we'd bring it to board for presentation and request to move forward. So if this does happen, we'd hope to start in May and end in the end of the fall there.
Okay.
Another question, thank you. Going back to the old DMV property, we do share that, as you noted, with the state of Minnesota in terms of what testing they offer there, and that does provide a little bit of a revenue, a little over $15,000 annually. What are you hearing from the state of Minnesota in terms of what they want going forward? I think we have identified some space at our Moorhead Center Mall property that could work for them, but what are the conversations?
Yes, at this point, Lori Johnson has been having the initial conversations with them, and they are exploring what would be the best option. I think we touched here in a little bit, but the intent would be is that space would remain available to the state through December of this year. And so we wanted to get that information out to them as quickly as possible so they would have adequate time to make any adjustments.
I think one of the things, Commissioner Mojo, that maybe there was some concern about that Lori expressed, maybe on behalf of the state, was the issue of the CDL testing with trucks being at the Moorhead Center Mall, that may not work. And I suggested we already have a joint facility with the state that happens to be out on the south end of town that could certainly probably support that function, so it's something they can also use or look at using, so. Okay, anything else?
Well, I appreciate that. I just don't want it to get lost in translation. I know that we really heard from the community when the testing facility was closed because of COVID, how much of a nuisance it was for residents, and I want to make sure that we're part of the discussion to actively find a suitable spot for it. I agree that the highway facility would work great. Obviously, those discussions need to happen, but thank you.
Okay, I'm going to try to move this along a little bit.
Okay.
So if I can interject here, and so we have two things that we really want to accomplish today, because I think the city of Moorhead wanted us to act first on this swap agreement. And so it's before us today, and just, I think the exchange purchase agreement document here, Steve, if you want to go to it, that talks about the public health storage unit. It shows a value of $647,400. And then the public health storage building, which that's what we actually paid to construct that, right?
Yep.
So it's a grand total of $742,797.50. And the agreed upon price that we would pay for the full 20 acres plus specials was $545,397.50, which would end up being, give us $197,400. Now, keep in mind, the original plan was for solid waste to buy the property from the city for that same price. So under the transfer station fund that we're looking at for bonding, that was going to include that $545,000 to buy that land. So what'll happen is Kirk's Department Solid Waste will, instead of writing that check to the city of Moorhead, they'll write the check to Clay County, because we'll now become the owner. So it's a transfer of funds to one area. Now we do have a little bit of discussion as to how much of that might fall outside of your scope. So it might be that the solid waste fund might not pay for the full 20 acres.
Mr. Chairman, that's what I was going to mention, is that originally what we talked about was 17 acres is what we're going to buy.
Right.
And then the city was going to have 3 acres.
Yeah, so we'll probably, so what solid waste, I'm assuming what will happen is solid waste will reimburse the county for the 17 acres. And then the other 3-acre portion will fall under our capital improvement area that Joe's going to talk about, or that we're going to incorporate into our capital improvement bonding. So
that's exactly my understanding as well, Mr.
So that should tie together really well. And again, as Steve mentioned, this is a win-win for both the city and the county and our taxpayers. It's a really good opportunity for us. So with that being said, I know that John Shockley has been working on the final document. That isn't ready yet that I know of, or is it?
It is now ready, Mr. Chair.
Yeah, but I think the city was hoping that we would approve this agreement in terms of the dollars, and we'd be looking at, with that being done, there's an opportunity then for Joe to get going soon on our needs, to have that constructed and ready. And then the city was hoping for December or January occupancy, and we've told them that maybe we can work with them where they could have early access to that too. So we're kind of working together with the city on that regard, so.
And maybe, Mr. Chair, if I could, I would just add.
Yeah.
So John Shockley and then David Piper, as well as Onset Twitchell, and then myself and Steve have gone through the contract, several different drafts, and just worked through a couple of different issues. But this should be, or what you have attached to you now, would be considered as the final draft. And as to form and execution, I think we're ready to go. I think everything looks good. There had been some, I guess, little pieces to access and some of those things. And then the value number, I think, were some of the main things we got changed and finalized. So I think what you're looking at here should be the final draft at this point.
And I think the intention was to approve it and allow the title change to happen with the actual payments to follow in January.
January 28th of 2022.
Yeah, so there would be no change in funds until January of 2022, but.
Correct.
But it would allow us to move forward. We would actually have ownership of the land for when we start the work, which is something that was really important for us to do, to realize when we do transportation. I know Commissioner Mosho has a question.
Thank you. Was the city of Moorhead planning to be present for any of this today?
They did not indicate that they were going to be here today, no.
And I appreciate that you've had conversations with them at a committee level, but it's kind of hard for me to take action unless usually, it's interesting that they're not here to be part of the discussion today. I in good faith, understand that it's a plus for both sides, but it's difficult for me to act without them stating that.
I think the idea was, maybe Steve can correct anything else, but they were looking for whoever took action first, but they're asking the county to look at it, approve it, take action, and they expected to take action at their next council meeting.
On Monday the 12th, yes.
I think, Commissioner Mojo, and again, I apologize that a lot of this was at the committee level, but one of the things that I do know that there has been presentations made to the Moorhead City Council, and I think it was their request that as far as I know, and through Dan Mawley, they've agreed to the terms that John Shockley is writing up, and I think it was their request that we act first on it. And
That's correct, Mr. Chair.
so I think they've had a presentation similar to this at their level to get a consensus from their group to support this, and I think they've done that. And so we're looking for a motion to move forward and approve the purchase agreement, subject to council's acceptance of it, and then we'll deal with the separate request of construction engineers if we do this. So what's the board's wishes?
Well, I guess I've been involved, along with you yourself there, with these meetings, and Moorhead's been involved in all this too. And I think we've pretty well hashed this back and forth, that we came up with a good plan now, and I'd make a motion to approve this purchase agreement.
Okay, we have a motion by Commissioner Gross, second by Commissioner Ebinger. Any further discussion?
Can we get the spelling of county corrected on the last page?
Yes.
What is it? I didn't.
Cootie.
Cootie. It says Clay Cootie.
Oh,
That's, yeah, and then there is a typo on that.
That's really minor, though.
All right, very good. All right, any further discussion? Seeing none, all in favor of the motion signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. All right, we're one step closer. All right, so now, Joe, you've asked for the hiring of construction engineers to help facilitate
Yes. Yes,
The new building that we would need.
yes, that's correct. In talks with how we would design this building, they're involved in a lot of Kirk's facility as well, so there's a site plan that kind of is an overall, that has to do with my plan and Kirk's plan. So, yeah, to streamline this to them, I'm requesting to hire them initially just to do the design cost of this and then bring us the proposal back in the amount of $2,500.
Well, it seems to make sense. They're working on the big project. They're gonna be out there. It's probably a wise thing to do. And that will, again, fall under, in case one of our board members is questioning where's the money coming from, that'll be part of that whole capital improvement dollar that we're gonna be coming forward with. Commissioner Kaylee.
Joe, in that 5,400 square feet of existing space that you mentioned earlier, was the public health included in that number?
The 5,400 square feet, yes.
Okay.
Yep, we basically added up what there was and then plus the 1,200. Yes, correct.
Got it, thanks.
Yep.
Right. So.
Yep, and if approved, we would start tomorrow and then have a proposal to committee in roughly 2 weeks. So.
All right.
And I think we've got a plan going in this, make a motion to approve that study.
Second.
We have a motion by Commissioner Gross, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Thank you for your work on this.
I have one follow-up
yeah.
question.
Yes,
Thank you.
yes.
I know that I'm new to the SWAT committee, but I know we've talked about this facility, the joint transfer station being a joint effort between Clay County and the city of Moorhead. Is that something that is continuing to be the plan, that it will be joint?
Commissioner Mojo, I think that's something that I've asked for, you and I both being on that solid waste advisory committee to get together with Kirk and with Lori to come up with a financial plan, but then also we're gonna have to still have that discussion. Is it gonna operate like it is now, or the city is gonna operate it, and we own the facility, or are we gonna make changes there? It's a dialogue that we have to have, and we have to do that soon. So that's kind of
Thank you.
where I thought we should go on that, so. And there's good and bad in both of them, so we'll have to weigh all of our options, so. All right, thank you. We're going to just take like a 3-minute break because I'm now about 17 minutes behind. All right. Janelle. Good morning.
Get adjusted here. I'm Janelle Cheney, District Supervisor, supervise both the contract Clay County office and the felony office. And today I brought with me most of our staff, hoping to put a face to a name. So they're gonna come up and introduce themselves, what position they hold, and how many years they've served Clay County. So we'll start with that.
All right.
You guys can trickle on up. Keep it flowing. We'll try to get these guys back on track to not work into the
Yeah, if you want to
afternoon.
make sure you talk into the microphone there.
I'm Karen Jenkins. I'm the administrative assistant, OAS staff, and I've been here just about 22 years.
All right. Welcome.
Thank you.
Morning, I'm Emma Pleasure, and my employment with Clay County started in 1988 under Sheriff Jim Fisher. I was a 911 dispatcher. So I've actually been with the county, and I'm with the Department of Corrections, Court Services. I started 20 years ago in May, so I will have almost 32 years in.
Oh, my.
It's been a great ride.
Is that microphone on? For some reason, huh? For some reason, it doesn't seem to. All right.
I am Ashley Pizzolatis, and I'm office administration staff, and I've been here for 2 years.
All right, welcome.
I'm Matt Verdos. I supervise a juvenile caseload and then pretrial caseload as well. And I've been with Clay County for 2 years as well.
Hi, my name is Eric Ness. I have the gross misdemeanor caseload with domestic violence and DWIs. I've been here 2 years, but I've got another 13, 14 years of PO experience.
Good morning. My name is Robert Fury. I work with the drug court caseload and the veterans court caseload. I've been with the county about 8 years.
Good morning. My name is Lindsay Turnus. I've been with the county for about 10 years, and I supervise a juvenile caseload.
Thank you. So a lot of talent back there.
I do want to thank you for bringing them up here.
Yes.
Glad to get to know them.
Yeah.
I probably won't recognize you when you get on the street again, but thanks for coming.
Right. And today we are missing Rick Young. He has 29 years of service with Clay County. He mostly handles the adult gross misdemeanor caseload, a lot of domestic violence cases. I would say, it's fair to say he oversees the domestic violence court, keeps communication going and agents access to the computerized system to give updates, those kind of things. And then another agent that we have is a juvenile agent, Tara Becker. She joined us recently after Shelley Ford retired after 30 years approximately. And she is doing Agent Academy. She was an agent with us previously. She went to do some work within the schools as a behavioral interventionist and returned back to us to work corrections. So we were happy to have her back with more experience. So she's another one. Our staff has maintained our staffing ratio for over 20 years. We have 6 agents within this contract office and 3 support staff. Just to give the new commissioners just kind of a little history, this contract office is contracted with the state of Minnesota, and so the Minnesota Department of Corrections oversees the office, provides training, keeps everything consistent within our felony office as well. In the felony office, Clay County also does have 9 felony agents and 3 support staff. And later today, you will hear also from our STS worker right after this. So just to give a little picture, I just wanted to highlight some of the things. We do have 2 specialty courts that the agents manage. Robert talked about the drug court, veterans court, and then there's the domestic violence court. Recently, I did a little bit of digging through the data. We did have 155 new domestic violence cases placed on supervision within Clay County in 2020. So that's pretty significant to have that many cases coming through. And our county attorney's office can probably speak to that, staying very busy. We also are in discussions about starting a mental health specialty court. So that's kind of the early phases, but something that may be brought up soon for many parties. This last year, as many departments probably spoke about, learning new things through COVID-19. We learned that we have to get kind of creative with supervision. In the community when COVID-19 hit. We did transition to doing mostly oral testing, drug testing instead of urine testing. That allowed agents to have that social distance. The client was able to provide a specimen and not be in proximity. We also learned to use virtual platforms at a high rate for low risk, medium risk individuals, kind of decreasing that face-to-face contact, but utilizing it when necessary. So we continue to use virtual platforms, trying to maintain everyone's health, whether it's clients, staff, those kind of things. So still kind of trying to transition into having the ability to have more face-to-face contact with those that are on supervision. As far as our budget is looking really good. We're staying within our budget. We're no area of concern. I think in the next calendar year, we'd probably be looking at an increase in the translation services that we would need in Clay County. One big change that is on the horizon is the Minnesota Department of Corrections is requesting to take over all technology related to the contract offices in the state. And so they are working with county IT to transition all computers, cell phones, computer applications, all of that would be under the state. And so that should be a cost savings to the counties. So that should be coming up. We are looking to transition into the courthouse, the contract office, I want to say May or June, and we're trying to coordinate the transition of the computer IT stuff at that same time. One big change, I passed out our telephone list. There are some that are confidential telephones on there, so I didn't make it for the public. But you will notice that agents will no longer have a desk phone. They will use their cell phones as their primary phone. So we've updated most of the departments throughout the county and state. One thing that we're looking forward to, the juvenile agents, Lindsay is here today, Tara is one that is absent. They're looking at providing a girls group within the county. They're gonna do a pilot here in Clay County or here in Moorhead. And then they're hoping to transition to some of the other smaller cities so that transportation isn't an issue. They're also looking at how could they utilize Zoom so that kids that maybe didn't have transportation could still participate. So we're excited to offer a strength-based, pro-social activity for women, young girls in the community. Another thing, the Department of Corrections is looking to provide COG intervention training, decision points. And so we'll hopefully get several agents trained in that so that we will be able to provide a cognitive restructuring program within Clay County. So that's been on the horizon for a year, but hopefully at the tail end of COVID, we can get that facilitated. So, and that is about all I have for updates. Any questions?
Thank you. Any questions? Yes, Commissioner Kaylee.
Just out of curiosity, the oral testing that you were doing instead of urine tests, is the cost about the same or is there a difference there?
There's probably a heightened cost with the oral. Yeah. And it really, there's more of a cost when you have to send it into the laboratory. And I can offer that most often we're not sending them in. Agents are having discussions with the client and trying to resolve the situation, and most often clients will admit their use and be able to move forward.
Thank you.
Yeah.
Yes. Commissioner Ebinger.
Yeah, in looking at what you've learned through the COVID, is it going to be something that you see as a long-term, this sort of distance, doing things virtually, or is it going to be beneficial to get back to face-to-face?
That's a good question. I think the Minnesota Department of Corrections is looking at risk levels, and the low risk levels, they would be looking at doing either a phone call or the Zoom meetings. Those are the individuals right now that we're meeting with an agent every 3 months or every 6 months. And some of those are, they're not person offenses, or they're still on supervision for financial matters that aren't eligible for a discharge, those kind of situations. But the high risk and medium risk, we would transition back to face-to-face. And I think they're looking at, if it's bad weather, things like that, or you have a client that says that they can't make it into the office, that may be an opportunity to do a Zoom meeting so that you can still connect with them and see what's going on. Although it's limited, you're still able to make that connection instead of not having any connection at all.
I find that reassuring.
Yeah.
It's the distance and not being able to put eyes on somebody to make an assessment is, I think, a problem.
Yeah. During COVID-19, I almost had to kick staff out and tell them, stop seeing people. They were pretty adamant. We're very thankful that we had a mild winter. Agents were meeting with people on driveways and in parking lots, and they didn't feel comfortable with having less contacts, so.
All right, can we, Mark?
Yes. Yes.
Well,
please.
absolutely. We got to hear about this wonderful program that we have.
Yes, and now we have Mark Dibble with the STS program.
Morning, I'm Mark Dibble. I've been the STS crew leader for just short of 10 years. This year's been a little different. We haven't been taking anybody out of the jail, but they've been providing me personnel through probation. And the only thing that I don't have is like every day when they were in the jail, I had them. And when they're on the outs, I got them one day, someday they're not there. There's a lot of, I don't know what you call it, excuses that they can use for not coming in because of the COVID. They don't feel good, whatever. We're still getting the jobs done. We did all the painting in the new county building there, except for the entryway where they put in the sheetrock. I think we're fulfilling the needs of the little towns, the townships. We've done some remodeling, park restoration in Hitterdal, and they've utilized this as best they can. And this summer I anticipate, now I've been talking to a few guys, they're gonna go back to the festivals, the Felton Field Days and Hitterfest. So I'm anticipating they're gonna use this again. I'd like to get the numbers up. Right now, because of the DOC standards, I can have 2 people in my van, and I gotta space them and mask them and all that. And then I can have other people drive to the job site, but you're not gonna get people driving to the Hitterdal and Hewlin and Hollies. I'm hoping something there, so I can provide the numbers. It's probably the hardest I've worked in this 10 years I've had this job, but.
Yes, Mark has reached out several times. I need more bodies. I need more bodies to do these projects. And it's definitely, I mean, COVID-19 was part of it with the limited ability to put several people in a transport van or be on site at a project. Probation staff has dug deep and tried to get their clients that owe some hours or pay off fines, those kind of things, to be on crew. And I think we did try to keep the people that were showing up for crew consistent, just so that everybody's working with the same people and not, you don't have an influx of 25 different people coming every other day, those kind of things. So, but in looking at the numbers, it looks like we maintained pretty well. I know that things will pick up. We are hoping to get more bodies from the jail because, like Mark said, he knows if he's going to the jail, he's going to get X amount of people, whereas in the morning, he is sitting in the van waiting to see how many people are going to show up, and sometimes it's limited, and sometimes the individuals that show up may not be suited well for the project for the day. I know he's had some where it's heavy lifting and things like that, and
So you're saying you need more criminals?
we need more
Okay.
availability of people that are already incarcerated.
Commissioner Moschel.
They are there.
Are we gonna vote on that?
Thank you, Mr. Chair. I know a couple years ago, because of budget constraints, this program was on the chopping block. And you know, I'm very thankful that we re-looked at it. Mark, you do a phenomenal service to this community by leading the folks that you do. And, you know, I can just say from growing up out at the Clay County Fair, that group of individuals has really done work 10 times over to make the community a better place, and it's a great opportunity to for folks to give back to the community and pay off their debts to society. One thing I think maybe could be of use is that we had a report from Public Health today that they are sometimes seeing a vaccine surplus at the end of a vial, and I know that you've got a list of people that you work with and could probably get them vaccinated if they wanted to, but also maybe that would help us in terms of what we're dealing with regulations and how many bodies you can have in a van. But again, bravo, Mark, great work as always.
Yeah, I want to echo that, and I remember, Mark, with a couple of years ago, it was tough sailing from a budgetary standpoint, and I'm certainly glad our board recognized the significance of the value that it brings to our communities. And I'm certainly glad to support that. It's kind of like the drug court program. You know, it's an investment that we do, but the gains that we see from it is incredible. And so I will continue to support what Mark does in that area. And you know, there's another little group that's just within Clay County, and that's what Monty does. And I think you kind of are very similar to that regard. And between the two of you, you really run some good opportunities. So thank you.
I do want to say too, Mark, as I go to the township meetings, the city meetings in my district, I mean, they really compliment what you guys do out there, and thank you very much.
And I would, on the same note, I would add, you know, it's hard, I think, for our agents to have resources that aren't always a consequence or seen as punishment. This may start out to seem like that, but it's really educational. It really is a learning lesson. Mark, thankfully, brings a lot of skill to the table. He builds things and repairs things, his own equipment. He's, hey, can I take this home and repair it in my shop because it will save X amount of dollars? And so he's taking all of those skills and sharing them with people and giving them employability skills to take elsewhere. And just his personality is very approachable, and he gets along with everybody. He's brought the crew into our offices to do different things, and just the way that he interacts with them, it really is a benefit to the people that are on crew to have that relationship. And I would say that people that have been on crew find comfort in that, and some have asked if they can continue on crew, even though they owe nothing, they don't need to do anything, but they've built that relationship and they enjoy it. So I really appreciate having something within Clay County that's more educational and restorative than always, you know, punishment driven. So it's a good resource to have.
So how many days on crew with Mark before he starts telling everyone where his hunting spots are?
I don't know about that. No one's gotten that far.
Well, when I was a kid, I hunted Hitterdall, those areas, and when we take kids out to do projects, I'll take a different road, and they go, how the heck do you know where we're at? I hunt
That's why.
all over there.
All right, we don't need to get into secrets here.
Right?
And we will be coming back, or I will be coming back in about 2 weeks, I believe. The Department of Corrections just provided the updated contract. So I'll come back before the board to offer the contract for review.
Very good. Thank you, Janelle, and thank you, Mark, for your reports, and all the rest of you for coming and being introduced today. It's nice to see all of your faces.
Thank you.
Thank you.
Yeah. Rhonda.
Good morning, Mr.
Good
Chair.
morning. Welcome.
For once, it's not me getting you all behind.
Well, I'm glad somebody's taking responsibility besides the board chair.
Okay, I
Right,
am,
Commissioner Gross?
There you go.
all right, I am here today to seek approval to submit for a Department of Human Services grant opportunity. It's called Community Living Infrastructure Grant. It's a grant that our county has received since 2018. We have been the fiscal host to this grant, and it has served Clay County along with 8 other counties in our region and Wadena County. It has been a partnership with Clay County Housing Redevelopment Authority along with 3 community action agencies, so Mahubi Otwa, Lakes and Prairies, and West Central Community Action. This grant is intended to serve individuals who are homeless or precariously housed in our communities who have disabilities. So the focus is on outreach, connecting individuals to resources in our region, as well as developing expertise in our region regarding the housing support services and housing support programs. So we've received this grant since 2018, and as I indicated in the summary sheet, we've received approximately $778,000, which will take us through June. So this new grant starts July 1, 2021 and goes through June of 2023. We would continue a lot of the work that we have been doing, but one new piece that I've added in here is the request for a eligibility worker, or what we're calling a housing support specialist position that we would hire at social services, and it would be the position would be located in our income maintenance unit, and that position would kind of consolidate multiple tasks that we're currently doing regarding housing support. It's activities that we're required to do with or without the grant, but it seems as though the grant would allow this as a component. So I thought, why not put it in there and try to beef up our resources in order to manage this grant a little bit better and our applicants for the housing support program. So if approved, and if they approved it in our full request, then it would be adding that position, which would be a 2-year position funded under the grant.
And that grant would fund it.
Yes. Now, it's quite possible we may not get all that we've requested, and so we'd have to revise the budget, and potentially that could go or be reduced to something different, but we thought we would put it in there this first go-around and see if it's approved.
Commissioner Gross.
I mean, not that I would be against the grant or anything like that, but do you feel that a person would be fully utilized in work, you know, trying to find housing or for what we call disabled persons? I guess you're looking for housing. Is that there are many people that we could be work with? I mean, that many cases? You have that many cases?
Yeah, absolutely. Our housing support program, and again, this is just the work that we do at our agency, the housing support program, which was formerly called GRH, or Group Residential Housing, has increased, I want to say, over 45% over the last 5 years. And it's partly because it's opened up to some different housing support options, and we've been managing that in our office. But perhaps as important is this program also funds outreach workers. So Community Action, CAP-LP, along with West Central Community Action, would be hiring, well, they already have with the current grant, but they would be continuing their outreach workers that really go out into the community and help individuals who have been identified as homeless or precariously housed with disabilities to help connect them to resources. So this grant serves 10 counties. And then our position that we've built into this grant would also be a liaison to those other counties in terms of their housing support programs. So it wouldn't just be administering what's happening in Clay County, but it would be kind of serving as that expert to the other counties in this grant project.
So, Rhonda, if I can follow up, so the grant application, the funds you're asking for the grant that's to expire, you've added additional dollars to that grant request to cover this position?
Correct.
Okay. Okay, so it's all, so the hiring of that position could be subject to what dollar amount we get in the grant?
Yes, absolutely. I mean, it's quite likely we may not get all that we've requested. That's,
Right.
you know,
Are you
happened
looking
in
at the
the past.
possibility of someone from the in-house applying for this job, or is this?
I think it's quite possible that we would have somebody in-house, that we do have some staff that are very knowledgeable in the housing support programs. We actually hope that we would have some internal interest, and what that would mean then is we would just hire to fill their position. Should the grant funds, should we receive the grant funds, we hire the position, and then the grant funds go away. You know, we deal with this periodically with grant funds. That last person hired would have to go if it was a layoff situation, or we generally end up having attrition where we can handle that type of thing just due to turnover.
Commissioner Mojo.
Rhonda, thank you for your presentation today. My question is on what was requested during the agenda. It just states to reapply for the community living grant, but doesn't say anything about the job approval. Is that something that we?
Commissioner Mojo, I guess what I would like to do there is to approve the grant at this point in time. And obviously, anytime, for our new commissioners, anything that we've done in terms of new hires has been a new request on our budgeting process. And I guess I would still like, now granted, you probably want to implement that prior to 2022. But we can probably modify our 2021 budget based on the grant revenue. So, but I don't think we need to approve the position today.
No, absolutely. I was not requesting approval for the position today, really approval to submit for the grant. But I did wanted you to be aware that I had included that in there. I fully anticipated that if we were approved of the grant, that I would come back before you and then request the position at that time.
Thank you.
Very good.
I'll make a motion to approve the grant.
All right.
Second.
We have a motion by Commissioner Gross, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
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 Opposed, the same. Motion carried. Thank you, Rhonda.
Thank you.
Okay, so to stay on time here for Commissioner Gross, I'm going to ask that we give kind of a high level. We have two weeks worth of meeting to report on, and Frank, because I'm going to let you set the tone for how fast we're going to get through these committee reports.
Okay, I had a couple of meetings at Building Improvement Committee, which, no use going over that again, because we pretty much discussed everything on that agenda item, so that pretty much covered that. And I did view the but website on the Comprehensive and Transportation Plan. I looked at that, and personally, I thought they were getting off track a little bit as far as what we want as a comprehensive plan, I was looking more like, this is where it'd be agriculture, this would be residential and stuff like that. And I thought they were getting a little bit off track, but, this was the first meeting, so I don't mean to criticize or anything like that, but I just thought the meeting went off track a little bit, but I was glad to be part of that. Those were the 2 meetings.
In 2 weeks?
Yes. That's
You had a light 2 weeks?
Made it short,
Commissioner Mojo?
Thank you. I also attended the public input meetings for the county comp plan, and I also want to say that I appreciate the effort that really went into that, and the input that we received from the public was very valuable, but I think we need to continue to have these as we go forward. The more input we can receive, the better.
Yeah.
I attended the Land Management of the Diversion Authority meeting last week. We had an update or an approval on the policy for the disposal and management of project lands. I think it's important to hear from the pulse of the community on that and what they want to see with that going forward. I do do think that we took those concerns into account as we crafted what that would be. Had committee updates and had the property acquisition status reports. Good information for folks on that. The only item I will have for the two of you that are on the Diversion Authority Board, I've noticed that the upcoming meetings for the Diversion Authority are being published in the local newspapers. And I received the record review, and the title just says upcoming public meetings. And not until you get into the very bottom of it do you really understand that they're Diversion Authority meetings. And so as you talk about that, just to make sure that that's clear in the heading what meetings those are for the public to be active in that.
Okay.
I attended the Solid Waste Advisory Committee meeting. We talked about the increased testing that we acted on this morning and recognized Gate City Bank as our Clay County Recycler of the Year. As you probably all have a blue Gate City reusable grocery bag at home, they really do a lot for making sure that our community is recycling. I attended the MCC JPA meeting also, had property acquisition status reports and talked about the bio-geo monitoring program and upcoming property owner meetings that they're having with property owners. Had talked about the acquisition update for the Red River control structure and the monitoring easement acquisition updates. We approved a farmland lease agreement and approved 2 contracts for appraising. And then on Friday, I had the Extension Regional Director application reviews, moving closer to offering employment there. That concludes my reports.
Thank you. Commissioner Ebinger.
Thank you. On the 23rd, I met with Kawar Farouk, who's a representative from the Kurdish community, and we discussed some of the concerns they had, the Kurdish community has, part of which was hookah, which I think will be a discussion for later as ordinances come forward. On the 24th, they had the Diversion Public Outreach Committee, a couple of the educational and public information efforts that are being made by the Public Outreach Director were presented. And later that day, we had the Financial Committee as well. In my notes on that, we had some reports. There was nothing earth-shaking there. The following day, on the 25th, I had the Diversion Board of Authority meeting. Again, general business reports on that as well. On the 25th, later the same day, I had the Lake Agassiz Regional Library Board. Got the new Moorhead member sworn in. We reviewed the annual audit and had a report on regional activities. On the 29th, we had the Northwest Emergency Communications Board. Strategic planning was the third planning meeting we had, the final one. We completed development of our regional requests. They're going to be brought in the statewide strategic plan that's being developed later this year. On the 30th, Chairman Campbell and I met with the sheriff and some of his staff just to discuss issues involving the dispatch center. We'll be developing that over time as well. And that concludes my report.
Thank you. Commissioner Keeley.
On the 23rd, I also attended those county comprehensive plan meetings. That day, Commissioner Campbell and I met with the insurance committee, and there was presentation and kind of reviewed some updates on the bid process for annual insurance renewals and some potential changes that could be happening there. On the Thursday, the 25th, we had the CAP LP board meeting. We reviewed the director's performance review and had an overview of some grants and funding requests that are in process for them. Thursday the 1st, we had kind of a combined joint powers, joint facilities meeting. Moorhead Public Schools talked about moving to the Career Center this summer and some of the other small moves that will take place after that begins. We highlighted the county move to the new government center and what all is going to be in that facility there. That same day, I also attended the Children's Mental Health Local Advisory Council meeting. We discussed the upcoming Kids Fest event and their involvement in that. Some general business and transition of responsibilities for that group after Carolyn retires. And we also discussed the upcoming presentation to this board on the Children's Mental Health Services survey results. Friday the 2nd, I attended the Cascale Food Partners First Friday meeting. There was an update from Deb White on the Boulevard Garden project in Fargo and in Moorhead and some of the changes that they're looking at with that, as well as there's a new cooperative growing with local food producers, and they will be selling at redriverharvest.com, and you can also find them at Red River Harvest Cooperative on Facebook. So if you wanted to purchase locally grown items, that's supposed to be like a one-stop shop for a lot of our local producers there. Then Jim Walla of the Northern Plains Botanic Society and Trent Wise, our Moorhead City Forester, talked about the various food forest projects in the area and what those look like and how the community can be involved in those. That concludes my report.
Thank you. All right, I had on March 23rd, had the insurance committee meeting, of which Commissioner Kaylee reported on, and there's going to be a lot of work that's going to need to be, research that's going to need to be done moving forward, and the whole way this whole bid process is going to work is going to be very interesting, to say the least. The same day, I had a diversion executive meeting. We got reports from the executive director, and one of the things, and it's probably been on the news now, that you may have heard, that the Army Corps is going to be awarding the I-29 road raise bid. It's going to be a significant project. The low bid on that was $67 million, which is about $2 million over the estimate still, but still within the range of what the Corps was pleased with that. And again, that's a component that the Corps is responsible for. It'll be outside of the P3 project, and so they're going to be awarding that, I believe, this month, if I'm not mistaken. So, and at the time of that meeting, John Shockley informed us that the federal litigation was anticipated to be dismissed within the next 10 days, and that was from as of March 23rd, so that could be any time now, and that's as a result of the cooperative agreements with all of the other entities. And then I did give an opening and a welcome to both of the meetings that day for the comprehensive plan. The one at noon, I could not stay on very long because I did have the 1 o'clock meeting. But then I was able to stay on for the entire one, and that went from 5:30 to, and they ran out of time on that one with questions. On the 24th, I also attended the Prairie Lakes meeting. The big item of topic that day was the refunding, which we approved today. That same day, I had the public outreach meeting. And we had a video flyover presentation, which I'd like to probably have one done here again pretty soon for the board to see and our residents to see. There's really some progress being made there. Land management, and I just, Commissioner Mojo talked a little bit about the policy that we have, the mitigation policy that we have for land, and you know, Commissioner Mojo was kind of instrumental in making sure that farmland was properly talked about in there in terms of giving any unused land that it should first go back to the farmers, and I think we've got that well documented now within that mitigation plan, and I just wanted to point out Commissioner Mojo's efforts in that regard was good for our producers in that area. Thursday, we had a SWAC meeting, and again, Commissioner Mojo reported on that, and we've acted on some of those things. The MCC JPA meeting was also that day, and that's been reported on. I'm not going to go into that anymore. That afternoon, the Diversion Authority meeting, we got a flyover presentation again on the wild rice control structure and the diversion inlet project. Those were the kind of highlights of that meeting. I also attended with Commissioner Ebeninger on the 30th, the meeting with the Sheriff's Department regarding the dispatch center and some issues that are developing there that we continue to work with on. On March 31st, I had a Building Improvement Committee meeting, and there we talked about things that we acted on today. I don't need to get into more detail than that. On the 1st of April, the Clay County Joint Powers Committee, we talked about the fire and EMT proclamation that we're going to be doing there, and that's when we came up with the proclamation for public health, which we did today. We're looking at some MAT bus presentation coming up in our next agenda, and I also asked that includes some concerns regarding rural transportation in Clay County as well as MAT bus. So hopefully we'll have that included because we have issues there as well. And then, let's see. Building Committee on March 31st. That concludes my report. Steve.
Thank you, Mr. Chair. On the 23rd, I attended the Insurance Committee, which has been well covered. I also attended both of the noon and the 5:30 session of the Comprehensive Transportation Plan. That afternoon, I met with Kathy McKay, Troy Amundson, Rhonda Porter, and Brian Milton on some common issues with our detox facility. We had 2 different management meetings over the last 2 weeks, talking about vaccine updates, government center, insurance updates. Multiple meetings with Joe, Brian Melton, Mike Love out of Houston Engineering, Kirk Rosenberger on the resource recovery facility. Had multiple meetings over the last 2 weeks with city managers and county administrators in our metro area. I spent a lot of our time talking about American Rescue and COVID response. I attended the SWAC meeting on the 25th. That's been covered. Also the MCC JPA meeting that afternoon. On the 29th, we did fully open our government center in our new location. I know I've said before what great work Joe, Tim Dent, and Mark Sloan have done in the planning was amazing. And so I also want to point out our department heads. A lot of them, we saved a lot of taxpayer dollars by boxing and moving a lot of the things ourselves. And so our employees were great helps in making that transition. And would just note, Joe Olson and his staff, they took down all of the cubicles, they reset them up. They moved within their 5-person department, and that literally saved us tens of thousands of dollars. And so I want to just again give a shout out to Joe and his staff. And again, Mark Dibble did a tremendous job. We originally asked him to kind of paint a couple different areas, and that turned into the entire building. And so Mark just did a real nice professional job. And so the transition, I would say, went about as smoothly as possible, and I think it's to the great planning of our facilities director, IT directors, and our department heads. So spent a great deal of time over the last week and a half working with Brian Melton on a contract review that we had this morning in regards to the exchange and purchase. I participated in the dispatch discussion that's been addressed on the 30th. And 31st, participate in the resource recovery construction meeting. They're going to be starting here on a weekly or every other weekly basis as we get closer to the spring. The building committee, which has been addressed on the 31st, we participated in some media tours. We had WDAY, the Fargo Forum, the Barnesville paper, and the 4th had participated in the joint powers meeting that's been covered by Commissioner Campbell and Commissioner Cayley. I think just a couple things today. We're going to be beginning to meet after this for the American Rescue Committee, and so that information will probably be starting to come forward to this board again on a weekly basis once we have enough information. Again, just a reminder that we do have our rural cities and county meeting this Thursday at the Law Enforcement Center from 4 to 6 p.m. Again, that has two options of you can attend in person, socially distance, or we are going to have a Teams option if you're more comfortable with that. And lastly, I would just note during our board meeting, we did get an update that there is a virtual drug court graduation that's going to be held April 7th at 1:15 on Zoom. That concludes my report.
Let's just let the record show, Commissioner Gross, that we're going into our closed session 4 minutes early.
Oh, noted.
Challenge accepted.
Challenge.
All right, I do want to point out the county cities meeting on Thursday. I do have a medical appointment that I'm going to be at. I hope to be there, but if not, Commissioner Mojo will do the welcome and run that meeting on behalf of the county. Okay, so do we have a motion to?
Make a
no,
motion.
before we. So what we're doing today, there is no action to follow our closed session? Yeah. Okay, so just for the public, we'll be going into closed session. We'll come out of closed session and adjourn the meeting.
Mr. Chair, I make a motion to go into closed session.
Second.
We have a motion by Commissioner Mojo, second by Commissioner Ebbinger, and that closed session is as noted per statute on the agenda. All in favor signify by saying aye.
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 Opposed, the same. Motion carried.